Are you pleased, surprised, or just amazed at how things have gone?
Well, I'm certainly proud of everybody that's been part of the EMS change. This was a 60-year-old system that was completely overhauled and changed at the direction of County Council. When they voted on it, we had 45 days to put together a countywide system. We had county QRVs and stations to put in place, ambulance stations throughout the county that we currently weren't operating. Metro was only covering 50% of the county when this new system was implemented. We did it in the middle of a pandemic, we did it in the middle of COVID, and we also did it in a time when a lot of our leadership was having some health issues. So it's really remarkable what's happened. But you know, I'm just so thankful that we're surrounded by so many men and women that come in every day and take care of the patients when they're called 24/7. 365 days.
It's been, what, 18, 19 months ago. When county put this in, did you ever think it would move ahead this quickly?
We knew that with the quickness that we had to implement it, that we would have a lot of things we'd have to catch up and make changes as we went. I didn't think it would fall into place as fast as it has to this point. We're very happy with the accomplishments we made to this point and want to continue to improve it. When we first started evaluating the numbers, we were doing it in-house. So to make sure that we were doing it correctly and that there was no bias, so we now have a third party that evaluates those numbers. They are better than what I thought they would be this quickly into it. We try to maintain the 90% of our responses have a resource on scene within that 9 minute and 59 second. We stand behind the numbers that we have, and we make them available to the public and publish them. I can't tell you another EMS service in the state of South Carolina that openly will provide you with their EMS response times. I'm not aware of one anyway.
And what kind of cooperative effort and what kind of hours of work did it take to get to this point?
When council decided this was the route we were going, it was pretty much a 24-hour-a-day thing until we actually went operational on that September the 1st. Then when it went operational, it was still on all hands on deck for the next 30, 45 days, making changes and making sure everything fell into place where it's supposed to.
So given that you already knew the numbers, how meaningful was it when y'all were named the best in the state by your peers?
It was very meaningful to us. It is something that I don't think Anderson County has ever received that award for. Definitely gives us something to shoot for in the future also.
How about you? When you were named the Director of the Year, how did that feel?
I was very surprised. I was.
Amy Jo West, an emergency room nurse at AMED Health for the last 26 years, and I am the base medical manager here at Lifelight, also here based at AMED Health.
And what changes have you seen over the years?
It's been a lot of change. Of course, there's a lot of change in technology as well for emergency services, and I feel like we have a lot more resources than we've ever had, which is, we can thank the county for that. So.
And how has the county's move 18 months ago or 19 months ago to a countywide EMS system, how has that improved healthcare in Anderson?
I think it's changed the dynamics in the fact that there are different options for employment with the county EMS services, and I think that they have really amped up their training and just have kind of put all hands on deck. And I think that has it's made it more palatable for people to come to the county and work for us too, because EMS, the systems across the state are all struggling because there's no staff. And so now people want to work for Anderson County. They want to come here and they want to be a part of it. So that's one thing I've noticed.
How about a cooperative effort? How important has it been to you all cooperating and working together on this?
Well, I can speak from the emergency department and Lifelight, and we have an amazing relationship with everyone, with MedSure, with, we never see a strange face. Like, we see the same faces, we all know each other, we work well together between the county with the QRVs and MedSure ambulance, and then in the ER, and then in Lifelight. So we all collaborate together, we all give each other loop closure, share where we could improve, what we could do better on each call, and I think that's the one thing that we have going for us. It's just, this is a group of people that want to be a part of this community and they want to do better.